Going back to that initial issue raised in 1938 is that Congress was now saying very clearly, look, these compounded drugs, it may be that the states are the ones who regulate the practice of pharmacy. It may be the states are the ones who license pharmacists. But these products are indeed subject to federal regulation under the Federal Food, Drug, and Cosmetic Act. They are new drugs within the meaning of the Federal Food, Drug, and Cosmetic Act, but under certain circumstances, the Congress was going to exempt them from these critical requirements in that law, in that statute. So shortly after this law became the law of the land, a number of pharmacists got together and challenged the law in the Western States case on the grounds that the prohibition against advertising their services and the drugs that they manufactured or compounded violated the First Amendment. And the Ninth Circuit Court of Appeals, basically the West Coast of the United States, agreed. It ruled that this prohibition on advertising was unconstitutional and that all of 503A was invalid. And they made this determination because it was their view that Congress had created this sort of a balance, this kind of a deal. The idea was they were going to create this safe harbor for these compounded pharmacies, but it was important to Congress that the physicians drive these exchanges, not the pharmacies themselves. And the Ninth Circuit decided that since this prohibition on advertising had fallen out of this, the whole deal was off. And they basically said all of 503A was unconstitutional. The First Amendment issue, the free speech issue, went up to the Supreme Court in 2002. And the Supreme Court upheld the ruling of the Ninth Circuit and said, yes, indeed, the prohibitions on advertising violate the First Amendment, and so that's clearly illegal. And that part of 503A is now defunct. The Supreme Court left unaddressed this question of whether or not the Ninth Circuit was right in determining that all of 503A was now defunct, or whether or not you could basically just surgically carve out that prohibition. And the FDA, the federal government, was not certain what to do at this point, but after some discussions with the Department of Justice, they took the position that the Ninth Circuit ruling was the law of the land. And now 503A, which had been enacted in 1997, was 5 years later off the books, and we were back to the same sort of chaos that reigned in the years before. FDA filled this void by issuing a second CPG. It was very much like the 1992 version. It continued to regulate pharmacy compounding through the exercises of enforcement discretion, again, to basically say all compounded drugs are unapproved new drugs. Those who are engaging in conduct that seems akin to drug manufacturing were going to be the subject of enforcement actions. Those engaged in traditional extemporaneous compounding would not be interfered with. The agency would exercise its enforcement discretion. The CPG listed factors that were very much like the factors that it had issued before. It tried, in many instances, to track what 503A had done. It tried to take, if you will, the best ideas from Congress and follow them. And again, as in 1992, the agency's stated goal here was to differentiate between what it saw as the abuse of the pharmacy license and the very useful public health service provided by certain pharmacies. Following the Western States case, several pharmacies then sued FDA in federal court to basically try and revisit this issue from 1938, which is to say, look, whatever happened in 1997 with Congress is off the books now. And it is our view, courts and FDA, that these drugs that are compounded actually have no business being regulated under the Food, Drug, and Cosmetic Act. Congress in 1938 never intended them to be regulated. They didn't intend for them to be regulated in 2002. The FDA was overreaching. And there was actually a district court opinion that agreed with the pharmacies and said, in fact, FDA has no jurisdiction over these products at all. It then went up to the Fifth Circuit Court of Appeals, and in 2005, the Fifth Circuit Court did something kind of interesting that further kind of confused and muddied the waters here. What it said was that actually these products are new drugs. They do fall under the Food, Drug, and Cosmetic Act. FDA was correct in asserting they had the right to regulate these in the way they did. But then it also concluded that the Ninth Circuit had gotten it wrong on that issue of severability. And so what it said was, actually 503A is alive and well, except for the provision that prohibited the advertising, which the Supreme Court had clearly said was unconstitutional. But the rest of that law is still on the books. And so what this meant was that 503A was completely defunct in the Ninth Circuit. It was alive except for the prohibition on advertising in the Fifth Circuit and of uncertain legal status everywhere else. And this uncertainty created real difficulties for FDA and frankly for the compounding pharmacists as well.